Happy day to you. I'm here to talk to you about fatty liver. Fatty liver is basically excessive fat in the liver, which has now turned out to be a common problem in our country. It can be diagnosed usually by when an ultrasound scan is done and the radiologist gives a diagnosis of fatty liver or a bright liver. It is a very common diagnosis, common to the extent that if you look at many of the ultrasound reports, the radiologist will feel that the liver will give a report of a fatty liver. Now, why is it so alarming? It is alarming because it is so common. The statistics all over the world and also in India would suggest that this particular problem would affect almost 1/4 of the population. In India, the statistics are around the prevalence or the commonness is about 28% of the population, which is quite alarming, and that is why we believe that in the near future, India will be the fatty liver capital of the world. So, why is it that fat in the liver can cause harm? Excessive fat in the liver can cause inflammation, otherwise known as hepatitis, and it can then later on go on to develop conditions like cirrhosis, and nowadays we also believe that it can give rise to cancer as well. So therefore, fatty liver can be the warning signal to the development of many complications in later life. In fact, in the West, fatty liver is probably the second most common indication for liver transplant, the complications of fatty liver. So therefore, it is very important for us to know that fatty liver can be harmful in the long run. But then, because it is so common, we have to find out who are the people with fatty liver who can go on to develop complications. It is not all who will develop complications. It is only a small proportion. So therefore, if there is fatty liver, what we usually ask is, are there any risk factors? There are some risk factors about which we cannot do anything. For example, if there is a genetic predisposition, if there is a family history of cirrhosis, this is something that we cannot do anything. If sex is also, you can't do anything. But then there are many risk factors which can be modified. For example, if the person is overweight, that's a risk factor. And definitely weight control or weight management or weight reduction is the way out. If the person is a diabetic, that's another risk factor. So blood sugar control has to be nearly perfect. Alcohol use is another risk factor, and we always say that if there is a fatty liver, you should not use alcohol. And if there is a fatty liver, we also advise that you should take vaccination against viruses like hepatitis B and hepatitis A. So these are the various risk factors. Now, in addition to that, if there is increased cholesterol or triglyceride in the blood, that also needs to be controlled. So these are the various risk factors about which we can do something. A very common question that is asked is, okay, doctor, I have fatty liver, what is it that I can do about it? My answer is very simple. We look at the risk factors, we have a checkbox, and if there are any risk factors which can be modified, it should be modified. But the treatment of fatty liver revolves around two basic lines of approach. The first line of approach is diet. Today's diet, especially the youngsters who take junk food, fatty foods, fast food, and fructose rich beverages. These are all causes of increased fat in the liver. So we always say that a diet should be healthy. You should have some fruits, you should bring down the fat level, you should bring down the carbohydrate level also, and also decrease the total calorie intake per day. In addition to diet, the other most crucial thing is to control the weight. A regular exercise schedule, by regular I mean at least 5 days a week. 2 days you can still take rest. So 5 days a week, brisk walking for about 45 minutes a day is a reasonably good exercise. Other aerobic exercises, yoga, have been found to be good for control of fatty liver. If you're used to doing much more heavier exercises, there is no problem. Any form of exercise done in a regular manner, 5 days a week is good enough. Some people say that even with all this exercise, I am not reducing weight. Never mind. Weight reduction is ideal, but exercise is more crucial, and you do exercise, you do not reduce weight, still that is okay. Not everyone can reduce weight by doing exercise and diet. So therefore, these are the two major factors, and also, as I said, any of those reversible factors which can be addressed should be addressed. Medicines are only supportive. We must never look at medicines to be the cornerstone of treatment in patients with fatty liver. So what happens to the fatty liver once all these things are done? The amount of fat in the liver will come down. The chances of complications in the future will also come down. And of course, the life will become much more healthier, and the further risks would definitely come down. So look after your liver, look after your daily exercise, and look after your diet, and that will be the solution to fatty liver. Thank you.